name's Shireen Kassam. I'm a consultant haematologist at King's College Hospital, and I also work 1 day a week at Winchester University. I am founder and director of Plant-Based Health Professionals UK, a non-profit organisation whose mission is to provide evidence-based education in the field of plant-based nutrition and other lifestyle interventions for the reversal and prevention of chronic disease.
So I'm Dr. Sue Keneally. I'm a GP, but I also have a postgraduate degree in nutrition, so I'm doubly qualified as a nutritionist as well. And I recommend a whole food plant-based diet because one of the advantages of studying a degree in nutrition is that I was forced to study all of the evidence. If you have a strong opinion about whole food plant-based or low carb, high fat or Mediterranean or whatever your view of diet is, it's very easy to just read that evidence because it helps you feel good about what you already believed. Because I was forced to study everything, I could look at every perspective, and having studied it all, I believe a whole food plant-based diet is the best.
So I'm Lucy Russell. I work in the NHS as a sister. It is really helpful as an anti-inflammatory and also in terms of general well-being and energy and healing, which is really appropriate in the hospital situation. And I'm also very passionate to ensure that we give our patients, that we give really good advice, sound research-based advice to our patients, and also to share this with my colleagues, volunteering to assist in a campaign to make sure that we get rid of processed meat out of hospitals, because we need to make sure that food is our medicine and medicine is our food, and we need to be advocating the very best for our patients, but also for our colleagues.
I'm Dr. Josh Cullymore. I'm a GP. I live in Brighton. I recommend a plant-based diet because all the evidence shows that it's the healthiest diet there is. That comes from people like the World Cancer Research Fund. They basically recommend a plant-based diet together with reducing processed foods, salt and alcohol. So all the evidence shows that, and then also from my own personal experience as a practicing GP, I've seen the dramatic effects and benefits that a plant-based diet has had. It actually prevents and reverses a lot of chronic conditions such as heart disease, diabetes, strokes, certain types of cancer, obesity. So it really is something that I would recommend to everyone, and particularly to people who have chronic conditions. Yeah, I think that all GPs should know about the power and effect of plant-based diets. Actually, diet is the #1 risk factor now for chronic disease. And it's a real shame that most doctors and GPs don't know much about nutrition. We don't receive much nutrition training at medical school. So that's something I really want to try and change, to encourage my colleagues to actually to help their patients in the most beneficial way with some simple lifestyle changes.
So my name's Dr. Gemma Newman, and I'm a GP at a busy NHS practice. And I love to recommend a whole food plant-based diet for my patients because I really see tremendous results for them. So I've had patients who've been sworn meat eaters, sworn dairy eaters, and when they've taken some of my advice on board, the transformations are unbelievable. Blood pressure problems go away, arthritis pains disappear, period pains disappear. They're really improving their outcomes from chemotherapy and cancer and heart disease and diabetes. The list of chronic diseases that it helps is almost unbelievable.
My name is Kate Dunbar. 15 years ago, I became very ill. I came down with a form of arthritis that people didn't know my doctors didn't know what it was at all. But about a year later, decided it was probably psoriatic arthritis. My consultant, rheumatologist, told me that food had absolutely nothing to do with my disease and my condition. So over the years, I managed to cut the drugs that I was on. I was on immunosuppressants. That's why I think a whole food plant-based diet is so amazing, because it's actually allowed me to reverse my disease and now I want to go on and help other people to reverse their disease too.